have a website I want you to go to, CarrieBarber.com. We're going to talk about the 10 things about health insurance I wish you knew. You got it? Go to CarrieBarber.com. That's KerriBarber.com. One more time, KerriBarber.com. Go to CarrieBarber.com. The page is 10 things about health insurance I wish you knew. And Carrie, as you might have figured out now, not only knows about health insurance, but is an independent health insurance consultant. What does that mean? That means Carrie can get you Blue Cross, Aetna, United Health, Assurant, and other top-rated companies, but Carrie does not work for the insurance company. Carrie works to get you what plan works best. Now you're saying, okay, well, how come I can't do that? Okay, have you ever seen an insurance plan? Take one out, your old one, or ask your significant other because maybe they handled this for you. Take a look at the size of the document now. Think, there's a new federal law, and there's all new booklets for you. Now, would you like to do all of this? Paging through, also keeping up on the newsletters, the updates from the companies directly. Who's going to do all of that? That would cost you as much in time as you would be spending on the insurance itself. CarrieBarber.com does all of this as an independent health insurance consultant who is licensed to do just this. The website is KerriBarber.com. That's KerriBarber.com. 10 things about health insurance I wish you knew. Would you like to go over just a couple? I'm not going to read the whole website to you, but I would like you to go to the website KerriBarber.com. That's KerriBarber.com. Go now. This is a licensed consultant who is not beholden to any one company. This is the era we're in. Once upon a time, there were one or two places to get the item, and you called them or they called you, and it was just no choice involved. Very few options. The world is different in health insurance. Here is your window into the new world of health insurance with value and someone who's looking out for your pocketbook. Someone who's looking out for your pocketbook but getting you value in the health insurance market and is licensed professionally to do so. All right, 10 things about health insurance. Carrie writes, I wish you knew. I wish you knew, Carrie Barber writes. Go to KerriBarber.com. That's KerriBarber.com. Go to KerriBarber.com. The page is 10 things about health insurance I wish you knew from Carrie Barber. All right, number one. You need to get coverage. You need to get coverage. You need to get coverage. You need to get coverage before you need it. People go, I don't need coverage. You need to get coverage. People go, I don't need coverage. You need to get coverage. I say this several times. You need to get coverage. You need to get coverage. Carrie Barber and Ed Till are saying the same thing. Item number one, you need to get coverage. Carrie is making sure I add, before you need it. I'm not mincing words with you. You need to get coverage. The Ed Till Show directing you to Carrie Barber. That's KerriBarber.com, directing you there. 10 things about health insurance I wish you knew, Carrie Barber writes. Number one, top of the list. Number one of 10, you need to get coverage. I am saying you need to get coverage. Carrie is reminding you, you need to get coverage before you need it. I'm telling you the time is now to get coverage. Carrie is a little more diplomatic than I am. Number two, insurance means access. Can I say it simple? Simple as could be. Insurance means access to health care. No insurance means no access. Let's not even talk about that. What was item number one? You need to get coverage. Item number two, insurance equals access. Number three, Insurance provides help. It is not a free ride. I don't know what movie you saw from the 1920s where Grandpa comes home waving an insurance policy and everybody thinks it's a ticket to, a free ride. It's not. That was a movie. And this is the real world. KerryBarber.com. Go to KerryBarber, KerryBarber.com, and follow along. But you need to know what you're up against in the new health insurance world. It all begins October 1st. It's unbelievable. Some of the law has been withheld because it's not ready. Much of the law is getting traction October 1st. That's any minute to you and me. Next, even with group insurance, you may not be covered. I hope you understand when you're covered and when you're not. Next, there are many products that can fit every situation. You have no idea how many different ways you can insure properly. You need to know how to insure. You need to go to KerryBarber.com. That's KerryBarber.com. Go to KerryBarber.com and see exactly what you need and save money, but get the proper coverage. And please go back to item number 1. You need to get coverage. You need to get coverage. I can't say it any more strongly. You need to get coverage. And insurance equals access. Get insurance coverage. Get health insurance coverage. Health insurance means access to health care. All right. And it's not a free ride. And I know you're following with me. I'm gonna try and lighten up on you a little bit. I feel like this is becoming, a graduate course and don't do anything wrong. And I'm not saying that to you because it shouldn't be an intimidating environment, healthcare. It is a rough one. It doesn't go over in 10 minutes at the kitchen table. There was never a time when things like this went over in 10 minutes, but I understand it's a lot more complicated than when your parents took out the insurance and your mother was filling out the claim and your father is describing the ailment and he's reading the amount on the receipt. We all understand that. We've moved on. Here it is. And really, my tone is one of help. Kerry Barber is not just an authority, like I've made Kerry Barber sound here for the first 5 or so minutes. I make it sound like it's the voice of God, but in a way, it is health insurance. Well, I don't want to take it too lightly, but Kerry Barber is ready to help you, and you, I know, could use some help. All right, so that's where I'm going to leave this parting thought with you about KerryBarber.com. If you would go to Kerry Barber, that's KerryBarber.com, you can see why I get all worked up about this topic. I mean, I've been around a few times, over the years having health insurance plans. And I've had them with big, big companies, and I myself have been with big, big companies at times. And now as an independent operator, my whole view of insurance has changed in the last 10 years. That's a given. Today, we're faced with the challenge and the answer to individual healthcare, family healthcare, group healthcare insurance. The answer right now, in this moment, important though it is, it's a good moment for us. We're going to save money. We're going to insure better by going to KerryBarber.com. Go to KerryBarber. That's KerryBarber.com. And see what the path that is correct for you and the insurance of your family, for your needs, for your age, for your conditions, for your circumstances, for your financial situation. This is the balance that a professionally licensed health insurance consultant can do for you by explaining your options among some of the best companies in the biz. Let's not mistake reliability, and let's remember that the setup for healthcare now a little bit more complicated. How great for you that you have someone you can trust who knows the field, knows the offerings, and is making a great reputation on customizing the insurance plan family by family. All right? Never think of medical bankruptcy. Please, I don't want to go to any of the negative headlines here. This is a sensitive enough area. You're the head of a household. You're a father, a mother. You're responsible for other lives. You have a significant other in the other room, and who knows what the health conditions are in the household at large. So I'm not going to listen to any of this political stuff. I'm not going to listen to any of the nightmare scenarios. I'm like you. We've been together a long time on this radio show, and we've been through many, many changes in the world, and health insurance is another one. Tonight, today, tomorrow, the day after, but soon, you are going to go to KerryBarber.com. You're going to straighten out your health insurance once and for all, get it under control, make it quality insurance, number one, and have it match what your risks and conditions are. It is mandatory under the law, so let's get the health insurance that serves best. Kerry Barber is a licensed professional who does exactly that. Go to KerryBarber.com. It's KerryBarber.com. That's KerriBarber, KerryBarber.com.